Hi everybody, if you're just joining me, my name is Dr. Mary Claire Haber and I am a board certified obstetrician gynecologist who has chosen to focus her care and practice on the care of the menopausal woman. I also have a certification in culinary medicine, and I put my passion for women's health and menopause together into my book called The Galveston Diet. So we're going to be talking a little bit about this tonight, as well as answering some of your questions about menopause. Really basic questions I'm happy to answer. I can't do anything specific to you personally. I can't practice medicine on Facebook or TikTok. I'm going live on 2 platforms. So if you have any questions you'd like me to answer, go ahead and drop them in the comment section on either page. So you might see my eyes switching around because I have 2 cameras going at once. I'm killing 2 birds with 1 stone. Okay, I want to take a second, talk about, don't let the name diet fool you in the book. This book is really a lifestyle and wellness guide to living your best life in menopause. It's taken everything I've learned academically and everything I've learned in my nutrition studies and combining this into a nutrition program that's going to help with belly fat, with visceral fat, with belly or visceral, which is the intra-abdominal fat, and we can talk about that in a minute, and with some of the hormonal changes that are happening to you in your menopause transition. So this was published in January. It was a national bestseller for several weeks. It's still selling really, really well. It is available anywhere you can buy books. Amazon has it on sale for, I think, $18.99, and it is available for an ebook and on Audible as well. But I will get to your questions. Make sure you drop them. Okay, so I'm going to read you guys the dedication. To every patient, friend, coworker, student, and follower who said, "Help me, I don't understand what's happening to me." So this is not just a diet. This is an educational primer on menopause. And it's in my attempt to explain to you what is happening to you and your body on a hormone and physiologic basis, and giving you some solid nutrition-based and tools that you can use to try to guide you through this without as much weight gain as so many of us are experiencing. So from the first day of our life until the last, our bodies are always changing. This is a part of aging, a natural process that no one can escape. But the changes that happen to a woman in midlife are unique and often unsettling. Suddenly, we're having odd symptoms like hot flashes and accumulation of a strange new weight gain around our midsections. Our skin can be very dry or wrinkling more. We may have joint pain, hair loss, headaches, bloating, or worsening anxiety and depression. Sleep becomes elusive, and sexual intercourse can hurt. Little things. I tell you, my patients today were telling me that they felt that they weren't themselves. Like they all come to me somewhere in their menopause journey. Either they're perimenopausal or postmenopausal, and they are coming to me for nutrition, wellness, pharmacology, for a menopause toolkit to help them live their best life, because they don't feel like they are living their best life. And musculoskeletal issues are huge. About 71% of you will experience musculoskeletal pain, and with no injury. So you just go to bed and you wake up and you feel like you fell out of a 12-story building, and it's like frozen shoulder, trigger finger, hip pain, joint pain, knee pain. Nothing in your body is off limits, basically. There are estrogen receptors throughout your body. A lot of this, I'm reading to you from my book, The Galveston Diet. So a lot of this may be happening to you right now. Trust me, you are not alone. You are not alone. Let me introduce you to someone who knows exactly what you're going through. Me, because it happened to me. I was a busy physician, mom, and wife in my late 40s. My main health challenge at the time was a lifelong battle with polycystic ovarian syndrome, a condition caused by insulin resistance in which insulin can't do its job of ushering glucose into the cells for energy. PCOS, as we call it in my world, leads to erratic periods, acne, infertility, ovarian cysts, and unwanted hair growth, as well as a multitude of other problems. About 1 in 10 women of childbearing age has PCOS, and the majority, about 70% of them, of us, were overweight or even obese. But I happen to be in the 30% of normal weight. Fortunately, in my case, PCOS was treatable with medication. There was no cure. There is no cure for PCOS other than menopause. But in my case, taking birth control pills in the form hormones in the form of birth control pills really, really helped me. Then came a death in my family. I lost my precious brother, Bob, to liver failure. I was despondent. He was the most fabulous uncle my daughters could have ever imagined. He was a fun spirit. They had this really great bond. We were dance partners. So one of the things you may not know about me is I was a champion jitterbug dancer. My mom and dad taught us how to cut a rug when I was a little girl, and my brother was a fabulous dancer. And we would enter these jitterbug dance contests all over Louisiana, and I would win money, and that's part of how I helped pay for college. So when he died, I wasn't ready. You know, he had been sick for a while, but I thought we had more time, and I had this just sudden crushing pain. Grief does strange things to each of us. For me, I coped by binging. Night after long clinic shifts, I would stand in front of my pantry gobbling handfuls of goldfish crackers, and then I'd wash them down with glasses of wine. Pretty quickly, I'd gained 20 pounds. I looked like a different person, and I felt miserable. With my medical background, I knew that at my age, it might be time to come off hormones for a while to see if I was menopausal. So I talked to my own doctor, and we agreed that I should. But taking the hormones that I was on for the PCOS had actually treated and masked my perimenopausal symptoms that occurred during midlife. So within 2 weeks of being off of the birth control pills, my life abruptly changed. Abruptly. I was having horrific hot flashes. I was burning from the inside out. No sleep. I could not fall asleep. If I did fall asleep, I would wake up within an hour or two, tossing and turning. I was so fuzzy-headed. My mental fog was horrible. I felt like I could not do my job. My long, beautiful hair started falling out by the chunkfuls. Does this ever happen to anyone else? I mean, this was happening to me. And I had... my skin felt parched from head to toe. I lost collagen. I started getting that dimply skin. My body ached so much that I kidded with a friend I'd give up my firstborn baby to get relief. And so my sleep became a recurring nightmare of multiple awakenings throughout the night, at first drenched in sweat and then freezing once the hot flash had passed. So I knew I was going through a period of hormonal change, but I was so depressed and grief-stricken for my brother. I thought this was grief. I thought this was how my body was expressing grief. And it took me a couple of months to realize, oh my God, I haven't had a period. This is menopause, you know? And so, and then, you know, all of these horrible feelings, you know, and I really thought, honestly, guys, I thought I was going to tough it out, that I wasn't going to take hormones. I didn't know all the new studies. I didn't know that the Women's Health Initiative had been walked back. I didn't understand how safe hormone replacement therapy actually was. And I felt like me going in to beg for hormone replacement therapy because I was suffering so much was a form of failure for me, okay? So I started taking the hormones, and not immediately, it took about 3 weeks before I could sleep through the night. And once I could sleep, then things started to kind of slowly get better for me. So then I went to work on my weight, and I did exactly what I and other doctors had counseled patients to do forever: work out more, eat less. And I'll be honest, that had worked for me all the way up until this point. It was getting harder, but it would eventually work. Like I would diet myself down to really severe caloric restriction until I got to it, and I would work out like a crazy person until I got to the point on the scale where the number was happy and my clothes fit well. I didn't understand that I was losing a tremendous amount of muscle by doing this, that I wasn't eating enough protein, that I wasn't doing resistance training. It was all about cardio, and starvation. And that was my plan, and basically a version of that of what I recommend to patients. I didn't understand about nutrition and how important it is to get enough protein, enough healthy fats, enough carbohydrates to feed your body so it stays healthy while you get rid of the excessive fat. So my efforts paid off, sort of. I'd lose a pound or two, but that was it. The weight would come right back on. I was starving myself and working out obsessively, but hardly dropping any weight. It was very frustrating. I just wanted to fix me, but nothing I did was working. Anybody out there in either world feel this way? You've done everything and things that worked in the past, and you cannot figure out what is happening. Why do you feel this way? Why can't you think? What is going on in your body? So I realized I was struggling with the same weight issues, the belly fat, that my patients were complaining of. They would sit, this happened today, they sit in the exam room and they grab their tummies and like kind of jiggle it at me and say, what is this? Why is this happening to me? What can I do about it? And the workout more, eat less mantra was not working for them or for me anymore. So what did I do at that point? What do you think I did? I doubled down. I started calorically restricting to a point where it was dangerous, okay? And then I decided I'd work out twice a day because that has to work, right? So I threw myself at that point when I realized my girls were watching, my teenage daughters were watching me. I was saying the most negative, horrible things about my body. My husband was getting concerned. I was getting up at night to pee because, menopause. And then I would weigh myself. Like I realized I was in this unhealthy place. And my husband kind of looked at me and was like, honey, I love you. I think you look great. But this is an obsession and this is not healthy. What you're teaching your daughters is not healthy, and wake up, And that was really that kind of light bulb moment, that thunderbolt moment for me that I said, okay, I can't do this anymore. I have to figure this out. My husband's like, you're smart. Figure this out. Other women aren't, this is doable. You can figure this out. So I had to have me like question everything I've been taught. Like, what is going on in menopause? So many of my patients are suffering from this exact thing. And I have to say the whole menopause conversation for me started with vanity. Basically, weight gain was not about health because I was not like obese, all right? I was 10, 15 pounds heavier than what made me happy, 20 pounds heavier. And it was still not it was a little bit overweight, but it wasn't, but I wanted to look skinny again. Like thin was what I was going for. So that was the beginning of my journey. That has completely left my mind and changed. But I want to be honest with you guys. This was my path and my understanding at that point. So then I'm like, there's some, I start researching. I call up a PhD nutrition scientist at the university I was employed at, and I delivered all their babies and we're all friends. And so I'm like, hey, okay, I'm going through this. My patients are going through this. What is going on in menopause? Like the calories in, calories out thing isn't sticking. It's not really working, and it's not consistent, and they're like, look, we know that aging is causing inflammation. Something is going on with insulin resistance changing. Something is going on with how your body is processing carbohydrates where you can't get away with the things you used to. So something is going on with menopause and inflammation. And if, so they gave me all these research articles to read, evidence around, intermittent fasting from Mark Mattson, evidence around anti-inflammatory nutrition, and so I started going deep dive on these rabbit holes of data and just got my mind blown. So I said, okay, I started seeing these tenets of things that I wanted to try on myself. So again, at this point, if this is a selfish journey, I am just trying to get my own weight off. So I'm like, okay, there's something to intermittent fasting, and that is one of the key components of the Galveston Diet. Now, not everybody has to fast. Not everybody has to have the same window. It's not for everyone, but most people can do it safely, and it's a great tool for anti-inflammatory nutrition. So what became a weight loss program started to become an anti-inflammatory program, and the weight would follow. So that's kind of where my mind went. Anti-inflammatory nutrition. Then I said, okay, I need to learn more about nutrition. Like some of this stuff's going over my head. I didn't learn anything about this in school. Like I just know the very basic, scratch the surface. I reached out to the PhDs and I said, can I get a master's degree through you guys? Like, is there something I can do, at night online? And they go, oh, well, there's this culinary medicine program for physicians. It's brand new. It's at Tulane University, and so I reached out to them. They're like, yes, we have an online option. I'm like, perfect. Cause I'm still working. I'm still delivering babies, doing surgery. But I'm like, I want to do this. And they're like, okay, it's, $3,000 and it takes 18 months. And I'm like, I'm in. So then I go and enroll in this culinary medicine course. Best thing I've ever done. Like it is a medical nutrition course. I also had to learn how to cook, how to teach patients, how to, prepare food and, ways to teach patients to be healthier using practical examples with nutrition, like really helping break down the mindset. It was so valuable. And then I had to take a board certification test and get certified. And now I'm a certified culinary medicine specialist. So I took all of that and I made these tenets of anti-inflammatory nutrition, utilizing good food choices, avoiding things that are pro-inflammatory, adding in some fasting, and then looking at macro and micronutrients. Like, what are women in menopause almost universally deficient in? Fiber, magnesium, vitamin D. And so that's the Fab 4 challenge. If you guys follow me and I do this Fab 4 challenge, you know, all of these little challenges and fun things I do are ways to teach you new habits, kind of getting away from that mindset of calories in, calories out. And, you know, not, a calorie is not a calorie is not a calorie. I mean, calories are important. I'm not going to negate that. You eat 10,000 calories a day, you're going to get fat. So unless you're some ultra marathoner running hundreds of miles a day, and then you don't have any knees. So, but, you know, really paying attention, which I wasn't doing. I was eating everything that was low cal, low fat, low whatever. That was nutritional shit, okay? I wasn't feeding my body with the right nutrients. So I put it all together into a little program, and I just started handing out a little pamphlet to my patients on this little thing I created. I had no meal plans, no recipes, just here are some tenets, here are some things, and I would coach them, and I practiced on myself, and it worked beautifully. Like, all of a sudden, like, whoop, the menopause weight came off, and I was sleeping better, I was feeling better, like my brain fog was better. I'm like, holy shit, like, I just made a few habit changes. And so then I started sharing it with patients. My girlfriends were like, what are you doing? You know, and this was pre-Ozempic and all that. And so all of a sudden we had like this explode in our community, and then in Houston, and everybody's handing it out and passing it around. So then I started talking about the program, the Galveston Diet, on social media, and that's where it blew up. And so, but then patients were, you know, people on social were asking more and more about menopause and just general questions. So I started digging deeper, and I realized that I don't know enough about hormone replacement therapy. I have not kept up with the latest studies. These studies have not been pushed forward by the American College of OB-GYN. This was not required reading for me. You know, I've been out here practicing telling people that, you know, HRT causes breast cancer. It doesn't. And oh my God. And so that kind of exploded into an educational platform that I now have around menopause. But it all started because I didn't like till the 20 pounds I gained in menopause. And so this book, you know, goes through my story. And so if you want to learn more about Galveston Diet, the book is available everybody buy. It is $18.99 on Amazon, okay? And you can send it back if you don't love it. It does have meal plans, but it has a tremendous amount of hormonal information about menopause, ways for you to identify what's going on. And on our website, in the book and in the online program, we have tools and tactics for you to be your best advocate at your own OB-GYN appointment. So yes, I do see patients. I have a menopause clinic. It is absolutely, thank you for the hearts, everybody. It is the best thing I've ever done. So everybody take a second, please, and give me some likes on the two platforms. So TikTok is over here, Facebook is over here, and drop your questions in the comments. And remember, pick up the book, $18.99. It's cheap. Ebook is like $13, and the audio is available if you can stand listening to my voice for 4 hours. We have meal plans if you're interested in here. We also have an online version. The online program is a one-time fee of $59, no subscription. You have access to a tremendous amount of resources and videos of me explaining. So if you're a visual audio learner, you may want to do the online program versus just getting the book. So, let's see. So the cost of hormone therapy. The book is on Audible. Yes, the book is absolutely on Audible. You guys can get it there. And I talk about exercise and all of that. So you can pick it up there, or online. You can get it anywhere in the world. So the book in the UK has a white cover. So, but this is the book here, and make sure it says my name. There's some copycats and some fakes out there. Be careful online, but it has to say me as the author, Mary Claire Haver, MD. And it's on sale on Amazon right now. It's 30% off, so you can grab it if you would like it. Okay, so let's get to your questions. Finally, someone is talking about fasting, macros, and anti-inflammatory diet and lifestyle. That's kind of my jam, guys. That's how I started in this space. It's kind of bringing it all back home. You just got my first book. I am now writing a second book on menopause, more about hormone replacement therapy and options for all the different joint aches, pains, hair, skin, nail changes. It's really a reference guide to help you get through menopause. Let's see. So drop your questions in the comments, and I will. Okay, the cost of bioidentical hormone therapy is killer. You're on like month 4. So my patients, when I prescribe hormone replacement therapy, I most often prescribe estradiol and micronized progesterone. Those are both body identical, and I prescribe it at a regular pharmacy that they can pick up. And even without insurance, if you use one of those, Mark Cuban things or the coupons from GoodRx, you can get it, both estrogen and progesterone together, for about $30 a month. $30 a month. So if you're paying more than that, why? You don't need to. You can get bioidentical, efficacious, safe, it freaking works hormone replacement therapy. You do not have to break the bank to do it, okay? Thank you for ordering the book. I really, really, really appreciate the support. That is great. I hope you love the book and you learned something. You were told you weren't eligible for a hormone replacement therapy since you're postmenopausal. Well, postmenopausal means you're done with menopause. I mean, that's who it's for. Hormone replacement therapy is for people who don't have hormones anymore, which by definition means you're postmenopausal. So absolutely, please, you are a candidate for hormone replacement therapy. You might lose some of the cardioprotective or neuroprotective benefits if you start more than 10 years after your last period. But it doesn't mean you can't take it, okay, guys? Thank you Claudia, thank you so much for supporting me by buying the book. The book is called The Galveston Diet. Please, I should have never named it diet. Don't let the word diet fool you. Diet and medicine, this was prescriptive. This was something for my patients, is a pattern of eating. Okay, this is a lifestyle plan and a ton of information around menopause. So let's see. You do fasting and you don't even hit 1,200. I'm telling you, you need to, if you just 1,200 calories, you're not losing weight. If you are doing calories in, calories out, and you are struggling with weight loss, I highly suggest you read the principles in this book, okay? Let's see. So, the 3 strategies for turning things around on the Galveston Diet. I know it's backwards for some of you guys, okay? Number 1, intermittent fasting. Again, there's different windows that work for different people. We go through multiple, and you really have to ease into it. And I talk about this a lot in the book. You don't wake up tomorrow and you fast for 12, 14 hours, 16 hours, okay? It is something you have to gently ease your body into, and I myself the gift of time, and I gave myself 6 weeks to become fasting adapted, okay, before I did it. So if you're just joining me on TikTok, hit my face 10 times like this. And on Facebook, you can click some buttons. When you give me likes and shares and comments, it drives the algorithm so that they show the video to more people, and it keeps me relevant on this platform, and it really, really helps. So I talk about fasting, I talk about anti-inflammatory nutrition, and I talk about something we call fuel refocusing. Learning how to think about key macro and micronutrients to make sure you're getting enough in your diet, the ones that most women are deficient in. So the menopause belly, did anybody out here watching, let me see in the comments, let me see with likes, did you do the belly fat challenge? Has anybody done the belly fat challenge? Let me see it in the comments. So if you don't know what the belly fat challenge is, I like to throw out these challenges a couple of times a year. And these are new habits that maybe you aren't doing something, and I do them with you, and it's usually 4 or 5 habits to get into that have been clinically proven to do certain things. So I have the Fab4 challenge, which are the most 4 common nutrients that a menopausal woman will be deficient in, and learning how to track those and just using nutrition to fill those gaps. And I have the belly fat challenge. The belly fat challenge is out on our website. It is absolutely free. We will email you all of the rules and the tracking sheets. It's so much fun. It is 28 days. And the rules are simple. So the rules that I picked are the ones that have been shown to decrease visceral and abdominal fat in menopausal women by studies, okay? So number 1 is making sure you're getting enough fiber in your diet per day. We teach you how to track it. We give you meal lists and suggestions. It's really, really fun. Number 2 is zone 2 exercise. So learning how to move your body consistently, 150 minutes a week is the goal. So 5 days a week, 30 minutes of zone 2, which is a heart rate zone, and we give you the charts to figure out what your zone 2 is. So it's a heart rate zone that is just almost breathless. Like you can talk, but it's getting a little hard, okay? And that zone 2 has been shown to be the most effective way to promote longevity, get your mitochondria healthy, and to burn fat consistently. And then so fiber, zone 2, stress, something that is stress reduction. And we give you lots of examples. That can look like different things for different people. I use meditation and journaling. I always thought that was woo-woo. I'm not going to do that. I don't have time for that. My brain won't slow down. I use a guided app. No sponsorship. I use Headspace. I love it. And it helps. It gives me a 5-10 minutes of guided meditation each morning. It really helps me set my day on the right foot. Okay. Anyway, the Belly Fat Challenge, if you're on TikTok, is at the link in our bio, 100% free. You just sign up and we email you all the information and you get going. You can get your girlfriends or your family members to do it with you. So the Galveston Diet cookbooks that are on Amazon are not mine. I did not make them. I don't know who made them. They're probably a scam. Do not buy them. They do not say my name. And we keep reporting them and they take them down and another one pops up. It's really, really frustrating. So Jessica did the Belly Fat Challenge and she lost 3 inches off of her waist. Yay! So we don't weigh ourselves in the Belly Fat Challenge. This is for belly fat. So we measure the waist-hip ratio and we teach you how to do that. Gwen, you're overwhelmed with all the info. Where do you start? You're 44 and gaining weight like crazy. Honestly, I would start with a book. Arm yourself with education first so you can do the book, hold it in your hand, read it, or you can do the online program if you learn better that way, where I have videos where I talk for hours explaining all the principles. We have workbooks and sheets that you can download on the online program. It just depends on what works for you. Some people like to hold a book and highlight and underline and have all the meal plans, but the book is on sale at Amazon. So for $18.99, it's also available everywhere that you can buy books. So it is available on audio as well as Kindle or whatever ebook that you use. So the Belly Fat Challenge is free. Where is it? So if you're on Facebook, you can scroll down a few pages and gosh, look at this karate outfit. That's amazing. And you will see the links to join the Belly Fat Challenge. It's free. If you're on TikTok, go up to the link in my bio and you will see it up there. It's at the very top at the links in my bio. So you click on that and then it's just going to ask you for your email and your name. You put that in and we will start sending you the information and you can get started. We'll explain all the rules, give you trackers. It's totally free. Okay. Let's see. What progesterone do I use? So I use what I also recommend to most of my patients, an oral micronized progesterone. It's bioidentical. It's very inexpensive. It costs me about $5 a month, and I take it every night before I go to bed. No matter what you do, you can't retain or absorb vitamin D. You may need to move to injections. You need to talk to your physician about that. That's when we see that with people who are just poor absorbers, that you're going to either have to go on high doses for forever or consider an alternative method of getting it in your body, which would be injections at that point. I do love the E-string. So the E-string and the FemRing are flexible rings that fit inside the vagina, and they have the hormones embedded in them, the estrogen. And so you wear it in the vagina and it's slowly released. It's a transmucosal form. It's very safe, very, very effective. There's the strength for vaginal atrophy and there's the strength that's much higher for systemic dosing. So they both work great. They just tend to not have great insurance coverage, so most of my patients can't afford them. And so they'll do the patch for their estrogen rather than the ring. But I do like it. I think it's great. But even with my shitty insurance, it's like hundreds of dollars. And I'm like, you know what? I'll just wear a patch for $20. It works for me. Climera Pro. So Prem Pro, Climera Pro is not my favorite. The progestins in it are synthetic, which isn't horrible, but there was a study out of France, 80,000 women, and they stratified the breast cancer risk with the different types of progesterone. And oral micronized progesterone had the lowest risk. I was on the Combi patch for years, loved it. It was very convenient, but then I read the safety data and it's just a little bit more safe to do the Prem Pro, so I changed to do the oral, not Prem Pro, to do the oral micronized progesterone, so I changed it. Can you explain patch versus pellets, and can you take them while you're taking birth control? No. You should not be on multiple forms of hormone therapy. If you're on birth control pills, you should not be doing patches or any other form of estrogen, okay? So when we talk about, and this is a chapter on the book that we're working on, when we talk about hormone replacement therapy, medically, when we're talking with OB-GYNs about HRT, we mean estrogen. Okay, estrogen plus or minus progesterone. Progesterone if you have a uterus, no progesterone if you do not. Okay, now there are different types, chemical types of progesterone. There is estradiol, which is what your ovaries made. That is the gold standard for hormone replacement therapy, is estradiol. There's ethinyl estradiol, which is synthetic, which is in what's in most birth control pills. There are a couple of other synthetic estrogens out there. I don't really use them, so I can't speak much on them. There is also estrone, which is bioidentical, but is what is created in fat cells, and it has very little bioavailability. So it's a very weak estrogen, and some of you are getting that in your pellets. I do not recommend it. And estriol is what the placenta made. So I don't know why it's also not as biologically active as estradiol. So these companies are just making up this shit and not testing it and don't have any safety data, but they are putting estriol, it's biest and triest. So they're putting estriol and estrone with estradiol for no reason. We have no safety and efficacy data on that, and I do not recommend it. And if some wackadoodle is recommending biest and triest to you, you should say, no thank you, show me the efficacy and safety data, just give me estradiol, because that's what my ovaries made and that's what my body is craving. Okay? Why would they give you a pregnancy hormone? You're not pregnant. The end. So now we're going to do estradiol, because we're going to pick what your ovaries made, because that's what your body is missing and it's the most biologically active. Okay, how do you get it in your body? We have oral and we have non-oral, two big groups. So oral is a pill. Everybody understand how that works, okay? A couple of problems with oral that are not in the non-oral forms. With an oral form, we have the first pass effect to the liver. Anything we ingest, food, medicine, whatever, we take a pill, it goes through our gut, gets absorbed through the portal circulation, the portal vein goes right to the liver to be processed. That is how everything we ingest works. When it hits the liver, you see a bump in your clotting factors. So the risk of blood clots goes up from your baseline to 7 out of 10,000 women, okay, over the baseline. Not very high, but still there. So if you have any risk of blood clots, you do not want to do an oral form of estrogen. You want to do a transdermal or transmucosal form, okay, through the skin or through the mucosa. So also, AHA, American Heart Association, just came out with a new study showing that oral estrogen increases your blood pressure in some women. So for that reason, if you have a history of hypertension, if you're on blood pressure medicine, don't take oral estrogen. Go for the transdermal transmucosal form. Okay, so very few of my patients are on oral. It's really the cheapest way to go. So if they absolutely can't afford anything else, so they're not tolerating the patch, we'll do oral, remembering those caveats, checking their blood pressure, making sure everything else is okay. All right, now we have non-oral forms. Transdermal through the skin or transmucosal. Through the skin is a patch or the pellet, okay? Or the transmucosal, which would be the troches or the vaginal ring. Okay, troches are all compounded. Again, no efficacy or safety data on anything that's compounded. Zero, none, okay? You don't have to have compounded to have bioidentical. You don't. Don't let anyone tell you that. They're just trying to sell you something. You don't, let me say it again for those of you in the back. You don't have to go the compounding route and pay the premium in order to have something bioidentical, efficacious, safe, that works, okay? The patch is generic. It works great. There are problems with the patch. Some people have a reaction to the glue. So if you have surgical tape allergies or you have Band-Aids and you can't wear them because you break out in a rash, not for you. Not going to work, okay? It's the glue. It's not the estrogen. If some people, it just won't stick no matter what they do. Now, if you've tried it and you like it, but you're struggling with the stickiness, try this trick. Take an alcohol swab, make sure, get that thing, dry it real good, get all the oil off your skin, press that puppy on there, take a blow dryer, put it up to the patch for 10 seconds on hot, melt that glue, then press it. See if that works, okay? If it still doesn't work, it's not gonna work for you. We gotta go try another method. There is an FDA-approved, tested estradiol gel, no generic, very expensive, so I don't even go there with my patients. And I love the ring. I love the ring. Again, no generic, very expensive, works great. My patients can't afford it, okay? So that's your estrogen. Now we're gonna talk about progesterone. You have a uterus and you're taking estrogen, you must have progesterone, either through an IUD that contains progesterone. Love that, love that, love that for my patients. Or you can take the oral micronized progesterone, which is what I take. I take my progesterone at night because it helps me with sleep. It's a little bit sedating, okay? So, love it, love it, love it. Now, everybody wants to know about testosterone. Do I 100% recommend testosterone for every single patient? No. I don't have enough high quality data to support me doing a blanket recommendation. Right now, I use it for patients with hypoactive sexual desire disorder when other reasons for decrease of sexual function have been ruled out, like a relationship disorder. Testosterone's not going to fix it if you don't want to have anything to do with your husband because you can't stand to be in the same room with him, or y'all don't get along, or you do not feel a physical or emotional connection to that person, or they're abusing you. No testosterone in the world is going to make you want to have sex with them. You're going to want to have sex with somebody, but just not him, okay? So, testosterone, if it does not help you in 3 months with your sexual function, it is not going to help, okay? People are being overdosed. They're being transitioned to males against their will from a lot of people who are using some of the subdermal implants, the pellets. A woman in her life with their top ovarian function, top testosterone natural production, rarely gets over 70. And these docs are getting you 2, 3, 4, 5, 600. Let me see in the comments how high your testosterone levels have gotten with pellets. Because men feel good with treatment from 400 to 1,000, okay? So if you're a male level, 250 is still in the normal range, so he probably doesn't feel that great, okay? A woman needs about 10% of the testosterone of a man. So let's back that 400 to 1,000 level back to 40 to 100. 70 to 100 is in the really high zone, okay? You go over 100, you are toxic. There's just no reason. I don't know why they're trying to transition you to a male. I mean, if you are transitioning because you feel better as a male and that is how you identify, God bless you. I love you. Do it. You do your thing. Make sure you go to a specialist. That is not me. I do not need to transition anybody. That is not my specialty. I don't know how to do it right. Okay. But these docs are intoxicating these women with so much testosterone. Like, they're coming to my office. And they haven't gotten their pellets replaced in months, okay? Months and months and months. And holy shit, I'm checking their levels and they're still in the 300s and 400s. I'm like, what in the hell? They're having clitoromegaly, they're having mustache, beards, they're losing hair on their head, and they're not losing weight. And they're like, what's wrong with me? I'm like, you're toxic on testosterone. You're at a man's level. You're having male characteristics form. So, yeah. So you can do testosterone safely. You can do testosterone safely with pellets. But the company is recommending you overdose women. They're recommending a minimum of 150, and that is not okay. Not okay. Anybody in endocrinology who knows what they're doing would be like, what the hell are you doing? And they have no data or research to support those high levels. So, yes, I use testosterone. I do it in physiologic dosing. My patients are overall very happy. Does it work for everyone? No. Libido is a complicated thing, and there's not a Band-Aid that's going to fix everybody, okay? So, all right. If you're having those symptoms without pellets, you need to go get your baseline testosterone. There are tumors. Like, if you don't have pellets and your testosterone is over 100, we start looking for a tumor. Do y'all realize that? We look for a tumor. That is malpractice. If I don't begin the protocol to look for a testosterone producing tumor, if your base level without, supplementation is above 100, that is a red fucking flag. So, and here doctors are just willy-nilly giving women all this stuff. Now, if a randomized controlled study comes out and says 350 is where we all need to be, I will toot that horn and I will shout it from the rooftop. But that has not happened yet. Okay? Not happened. So, Climera Pro, non-generic, get generic. Let me tell you, the cheapest and most effective thing I do for my patients, and it costs them $30, $40, maybe $50 a month, is oral progesterone and the generic estradiol patch. Boom. Okay? So, Galveston Diet. Go. Who has bought the book? Who has gotten the book? Let me see it in the, who has read it or got it, the ebook, or listened to it, or done the online program. Okay. Oh, good. Thank you. I do have some fans out there. So glad, you guys. Thank you for supporting me. I really thank you. It really helps me stay in this field. It's really hard to be on social media. I get beat up a lot, especially by the bro culture. And I'm very open about my stance about equality in medicine, about women being treated equally. I'm fighting for us to get studies in menopause. And it's really coming against an establishment that really feels, a lot of people, that a woman's worth medically, socioeconomically is done when she's done with childbearing. And that the money that goes into keeping you pregnant, and pregnancy is important. I've had 2 children. I've lost 2 pregnancies. But like, why is my value as a medical needing person dropped to almost nothing when you look at the money spent on pregnancy and supporting pregnancy and even with all that money, our mama death rates are going up in this country. So it's like, and then almost nothing is being spent on menopause research. It's a sacrilege. We spend 1/3 of our lives on our menopause journey, okay, after we're done having kids. Us and whales are the only 2 species that have or are expected to live 30, 40 years without the benefit of our sex hormones. Okay, of our main sex hormones, of estrogen and progesterone. If that happened to a man, I did this video and I got, oh my God, the war broke out in the comments. And I made this video kind of tongue-in-cheek. Like, imagine if a man would, all of a sudden, his testicles just stopped working and then shriveled up and died, which is what happens to us. Maybe I used some terminology that was triggering for some people. At the age of 51, and he was expected to live from 51 until death without the benefit of testosterone, what do you think would happen? And that video on Instagram was my biggest video ever, and it got 2 million views almost so far, and the comments are legion, like that I'm a man hater and nah. But whatever. Okay, bro, go back to your keyboard. All right. Okay. Oh, look, counting stitches. Hey. So, oh, good. I'm glad you used the video. You guys are welcome to the video. I left it up. So, because the bros know women. So there's also something I want to talk to you guys about. There's this bro wellness culture that somebody brought up the other day. Ellen Vora, she's a great, she's an MD. She does a lot of work in psychiatry and psychology and nutrition and psychology. I really like her. You should follow her, Ellen Vora. But she talked about this bro wellness phenomena. Now, I follow a lot of the bro wellness dudes. So there's this longevity culture and this relentless pursuit of longevity that basically is just, focusing on minutia. They do these podcasts that are hours and hours and hours long, and you're just spending so much time researching and learning, you're not living. And it's like, there's no balance. There's no, and Ellen talked about the yin and the yang. It's like this relentless, constant pursuit of, I'm going to live forever. And I'm like, I want to live healthy as long as possible, but I'm not willing to sacrifice time with my kids and just being me, and so when I'm doing the menopause book, I'm not going to focus on the minutia. I'm going to just try to get you to understand a basic healthcare plan for the menopausal woman, because we've been ignored, and what that would look like with and without hormone therapy. Not everybody is a candidate or will choose hormone therapy, and your body, your choice. I fully support you in that, okay? But there are some potential health benefits for every woman that would choose hormone replacement therapy. So yes, I have a clinic. It is outside of Houston, Texas. I only see patients in person. You can find it at maryclairewellness.com. You can just Google Dr. Mary Claire Haver and it should pop up somewhere. So I also have a list of providers on my website that are recommended by my followers. These are testimonials and they place them on my website. We have divided them up by area, so you can look by state and by city and see if there was someone who is menopause friendly, who you will resonate with the testimonial, and decide to make an appointment to go see someone who has a clue. Also, the North American Menopause Society has a website that the NAMS, North American Menopause Society, has on their website has a list of certified providers in menopause care as well. So, and there's some in every state. So they are hard to find. They're few and far between, but there are some of us out there who are doing this kind of work. And you cannot expect your basic OB-GYN who delivered your babies and did your hysterectomy to really know how to do menopause care. It is very, very specialized. It takes every minute of my day to read up on the latest studies so that I can give informed, evidence-based information to my patients. I do a lot of teaching on the site, so if you don't follow me, please hit the follow button. Thank you. Follow me, guys, if you don't follow me. And y'all share this video. There's a share button on both if for someone you think that would benefit from this. Keep commenting, keep liking. And then this book can be a godsend. So many people have given me such positive feedback on this book that it's really helped them understand menopause. It's given them tools that they can use to stay healthy. It's given them information. I have blogs about how to advocate for yourself at your doctor's appointment. I have blogs about, signs and symptoms of menopause you may not realize that you're suffering from and what you can do about it. So this book is on sale at Amazon if you want to go grab one. It is 32% off or something. It's $18.99 on Amazon, but it's also available if you don't want to give Jeff Bezos any money. I totally get it. Everywhere that books are sold. We also have an ebook and the Audible book, and the online program is a one-time fee, $59. You get all these resources, downloadables, videos, all this good juicy stuff. If you're that kind of a learner and you want to learn more, I talk a lot. The hormone intensive is there, where I do a lot of education around hormones to give you some basic primers on like leptin and ghrelin and insulin and cortisol and what these things all mean and how in very layman's terms. Worth every penny. Thank you so much. Somebody said, how do I make money? Great question. Okay, so I have a clinic and I don't take insurance. So heads up, my patients know when they come see me, they're paying cash. I cover 2 visits. So they have an hour for their first appointment where we're just talking that whole hour. I'm getting their whole history, their menopause story, where they are, like we kind of untease all that. I do an inpatient in-body scan where we're basically scanning their body. I'm getting visceral fat level, muscle level, so I'm able to tweak their nutrition plan just for them. So I see patients 2 to 3 days a week. I was there today, which is why I'm in a fancy dress. And it's really a beautiful clinic that I just love, and I feel like I'm doing such good in the world there. So that's one way I make money. My husband and I have rental property in Galveston, Texas, which is like there's a big hospital here where my daughter's going to med school. That's where I worked for 20 years. So we have rental property that we rent out to like med students and nurses. So that's good. And then I have our supplement company. And then so we have our online program. So I got money for the book, but you don't really make that much money, did y'all know? Unless you sell bajillion books. And I sold like good books, but not like, anyway, so did okay. But then we have the online program, which, $59. So everybody pays a $59 fee, just a one-time fee. So we made money off of that. And then we have our supplements. We have Galveston Diet supplements, which are our fiber, our omega-3, vitamin D and K all together, our turmeric, and our collagen. And so those are 4 options for you. And we have a lot of information on the website about that. And so we do really well with our supplement company. It's kind of crazy to me. I didn't realize that I would be 10 times more likely to sell a supplement to someone than a book or a nutrition plan. So that's what helps pay the bills. No harm, no foul. But I'd rather you spend less money and learn than try to take a magic pill to fix everything. So berberine. So that is something I'm very curious about. I'm getting really excited about 2 things. I'm taking creatine right now. I'm experimenting with it on myself, and because there's some really good studies on muscle mass and the elderly. And so I'm really hopeful that the creatine is going to help me I have very low muscle mass I'm really thin with muscle, and so I have sarcopenia, and it's putting me at super high risk for osteoporosis. So I'm hoping creatine with my low dose testosterone, with my protein intake, with my resistance training is going to help me hang on to my muscle and maybe build a little more and keep me more resilient so that I don't fall and break a hip and die at 70. So that's what I worry about. So the Galveston fiber is amazing. Gold stars all around. I'm so glad. Thank you so much. When is the best time to take fiber? I take my fiber once I break my fast. I don't drink milk. I don't like milk. It's not because I hate milk or dairy. I just don't like milk, and it's not my thing. We don't. My husband doesn't like it either. I married the right guy. My kids are like, meh. So I like cheese. So I have cheese from time to time. Do I lift heavy? Yes. And so I'm working with a trainer. I've tried to lift heavy on my own and injured myself. So now I work out with a certified personal trainer twice a week, and I go to an exercise class twice a week, and then I work out in my gym. So I work out about 6 days a week, something, either walking or doing some weightlifting. But when I'm doing heavy, I'm doing it with someone who knows what they're doing so that I don't hurt myself, and that I can get stronger. So that's what I am doing. Been to 3 NAMS doctor, and not one would prescribe estradiol. Okay, let me tell you something. If you find someone on the NAMS website, they're not all going to give you HRT. So call ahead. Does this provider give hormone replacement therapy? Yes or no? Okay. So before you go, make sure you, any cholesterol help, fiber. I cannot tell you. You guys should be getting 25 grams of fiber in your diet per day. And the fiber supplements are just choices with, sorry, I have 2 screens going here and someone asked, okay. So thank you. Okay, creatine, perimenopausal. I'm reading the questions, guys. Hang on. Your doctor scheduled for an ultrasound. Oh God, find a new doctor to see if you're perimenopausal. Hello. Okay. If you know what you're doing, if you are a menopause provider and you understand pathophysiology, you diagnose perimenopause like you diagnose puberty. You listen to the patient, you look at the patient, you observe the patient. We may need blood work to rule out other things, but there's not a blood work or an ultrasound that is going to they're just taking your money, okay? The diagnosis of perimenopause is a clinical diagnosis, meaning listen to the patient. Look at the patient, touch the patient, and believe her. And that's how we make the diagnosis. Blood work is for post-menopause, okay? Confirming you are post-menopausal. That's it. That's what we do. The hormones fluctuate so greatly in perimenopause. A one-time blood test or a one-day saliva or urine test is non-diagnostic, and they are taking your money. Do not do the Dutch test. Do not do a Dutch test. It is not validated. It is not validated, and it's only run in one lab in the world, and your insurance is never going to cover it, and that is $400 down the drain. I can take that $400 and give you a whole lot better information. There's so many better ways to spend your money, like on a really cute pair of glasses. So, and these are not $400. These are $200. So, guys, don't do it. Listen, I will do anything for my health. Anything. I will do anything for my patients that they want to pay for, okay? Anything, but within reason and within validation. And if someone is having to do all this testing, they don't know how to diagnose it. They didn't listen to you. They didn't confirm. So everybody take a break, and if you're on TikTok, double tap my face as many times as you can stand. Boom, 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 boom. That will drive the algorithm and help get more viewers here. Facebook, give me some likes, give me some comments. Everybody give me some shares. But just tapping on my face on your phone screen will give likes and help drive the algorithm. I don't like turkeys. I think that's disgusting. They work, but I just don't like putting anything like that in my mouth. If you like them, fine. But they're compounded, so they're not approved or tested and never going to be covered by the saw your gynecologist and talked about HRT, starting your Bijuva. Good for you. Yay. You share my TikTok daily. Thank you so much. How many grams of fiber is in my scoop? 8 grams per scoop. Let's see. Yeah. So their oral testosterone, a troche, is considered to be somewhat oral, but transmucosal as well. It's a little tricky because of the liver, and it can increase your cholesterol. So y'all be careful. Transdermal testosterone does not do that. I don't think you need an endocrinologist to treat perimenopause. You just need someone who knows what they're doing. That's awfully special. And they don't know how to treat menopause better than anybody else. Thoughts on Primpro? Not my favorite. I don't do it. I do not prescribe it. It is what was used in the WHI study, and what definitively Primpro is what caused the increase of breast cancer, not Primo by itself. So I don't prescribe it, okay? I have better, safer, more efficacious options that are affordable for my patients, so I just avoid it. Berberine, okay, that's the other supplement. So I'm experimenting with creatine, and berberine I've seen some really, really positive stuff on, and I think it could be really helpful, especially, so I'm recommending it to my patients who are coming in with insulin resistance or, A1's pre-diabetic. So as part of their nutrition plan to consider a berberine supplement. Thoughts on Evernow and Alloy? Those are my two faves, y'all. So there's 3 direct-to-consumer, like telemedicine menopause companies that were developed for menopause that I recommend. I know the owners, I know the doctors. Zero sponsorship here. Okay, if you cannot find a healthcare provider near you, you may want to consider this option. Evernow and Alloy are kind of built the same, where they're basically pharmacies, and they will send you the medication from their own pharmacies to your house. They'll ship it to you. They don't take insurance, and the payment for your visits is basically built into the cost of the medicine, and the medicine is very reasonable. Okay, MIDI Health, MIDI Health, does take insurance, but they're not in every state quite yet. So MIDI does take insurance, and they will give you a prescription that you take to your pharmacy to get filled, okay? I do not use the Dutch test. I don't recommend the Dutch test. I would never ask my patient to spend that much money on something that is worthless. So no, I don't do Dutch. I don't do DHEA. Don't recommend, other than Intrarosa. Vaginal DHEA absolutely has been tested and proven, but systemic DHEA, it's worthless. Throw it away. Okay. Let's see. I'm looking at the questions, guys. Got the book. Just received the supplement combo pack. Yay. Collagen is 1 scoop, but the serving says not to a scoop for a day. So I always do 1 scoop with the collagen, but if I'm running low on protein, then I will add extra scoops. So like today, I was in a rush and didn't pack that much protein for lunch. So I did 4 scoops of collagen. I have the flavorless as well. So I'll do 1 of the flavored and then 3 of the unflavored so that I can get the little extra protein boost. There's 5 grams of protein per scoop in the collagen. So, and I have a personal protein goal of 100 grams a day. Okay. So my family is back from dinner, so I am going to go and hang out with them. But I had a great time with you all tonight. Everybody give me some taps and give me some likes and loves and shares. And please go and check out the Galveston Diet. It is everywhere books are sold. It's on Amazon. If you go to our website at galvestondiet.com, you just click on book. Or if you want to check out the online program, that is all there. The information is there. And hopefully this will get you started on your menopause journey and give you some good, solid, evidence-based ways for you to stay healthy during this phase of your life. And we will chat again soon.